We're saving lives. I think that's also changing lives.
I'm glad that we came here and did this noble job.
I always love challenges. As a medical student, I was fascinated about the nerve, the brain, neuroscience in general. So I moved to the US about 20-some years ago. I went to all kinds of schools and completed my residency, specialty, subspecialty. When I landed in Texas, I cannot be farther from my birthplace. But all those times, I think of Ethiopia, what we can offer to this country. Over the last 2.5 decades, the pattern of disease is changing. 70% of burden of stroke is in the third world country.
Most people don't know about the disease. It comes unexpected. All of a sudden, your life changes. For the family and for everybody, it's very devastating.
I'm a stroke expert. If I go to Ethiopia, I can help a lot of people.
Coming back home, it's like you really have to convince people about their health. The first year, basically what we've been doing is teaching the society how to come early, how to treat it, how to maintain the blood pressure, how to prevent it. The treatment is very expensive, so preventive measurement is really the key to go forward. My phone is 24 hours. Anytime they can call us, we're available.
We have to grow everything from nothing. And there is so much shortage of so many things here. And you run out of medications, you run out of devices, and the personnel that you have to train, and you have to take more responsibility as a doctor. Importing stuff is not easy because you have to import everything. Very simple things that you don't even consider that you would ever run out. All these things are challenging and you'd have to get used to them.
This is the first stroke center in Ethiopia. So all the patients that have vascular insult walk into our door or referred from other hospitals to get the treatment for a stroke.
We can evaluate patients very quickly in the emergency room. They get CT scan immediately to differentiate between a hemorrhagic stroke and ischemic stroke. If it is ischemic stroke, we have the ability to give TPA. After they receive TPA, they can either go to ICU if they improve completely. If they don't improve, they come to cath lab and we do the neurointerventional procedure to remove the blood clot from their brain. Then from the cath lab, they go to the neuro ICU where they will be taken care of 24/7 by intensivists or critical care specialists. Once they finish ICU stay, they go down into the lower level of care, which is the HDU, then the regular ward in the stroke unit. We also offer physiotherapy, and then they go home for outpatient therapy. Axon Stroke and Spine Center is one of the teaching sites for Addis Ababa University students. They come here and they get the education while they are still affiliated with the AAU. The curriculum is from the US, modified here in Ethiopia to address the local context. So far, it's a small institution, but we have been able to do everything that a large stroke center or stroke program has. So as far as we are concerned, I think we have many plans. We always want to make sure we stay an educational facility. I think education is key. If I wasn't going to be able to teach, I probably would not have moved to Ethiopia. We want to expand our capability in terms of teaching. The fellows that are working with us are already hired by the university. Besides that, we want to engage in clinical research. Most research studies don't include Africa. We are building a database to publish some papers. And of course, the most important thing is clinical care. We plan to build a tertiary facility where we can have the full-scale neuroscience program and high-end clinical program.
I don't know how we manage it. I remember there's some days oh, are we in the right place? Did we make the right decision here? And when you see the effect now, after the impact that you made within a few years, it's a lot. And believe me, even for the region, we're helping out. There's a lot of people that comes from neighboring countries like Somalia, Sudan.
I believe healthcare is a right. It's not a privilege. We're seeing the growth, we're seeing the impact that we're making, and we'll keep going.